that has sparked outrage across the nation. A pregnant woman was tragically denied medical treatment and subsequently lost her life due to negligence by medical professionals at various government hospitals in Freetown. The Ministry of Health and Sanitation has swiftly responded to the incident, terminating contracts and suspending individuals involved while launching a thorough investigation into the matter. The incident, which occurred on Thursday, 31st August 2023, has raised serious concerns about the quality of health care provided by government hospitals and the treatment of patients in critical conditions. The pregnant woman, whose identity has been withheld, reportedly sought medical attention at various government hospitals but was reportedly turned away, leading to a fatal outcome. In response to the incident, Dr. Charles Senesi, the Deputy Minister 1, Ministry of Health and Sanitation, expressed deep sorrow and extended condolence to the family of the deceased. He emphasized that the ministry viewed this incident as a grave violation of its commitment to providing quality health care to all citizens, especially pregnant women who required urgent medical attention. Dr. Senesi further revealed that immediate action has been taken to address the issue. Several contracts with higher doctors involved in the incident have been terminated, while the individuals responsible for negligence have been suspended pending further investigation.
And in his discharge from the duty, there was an unfortunate situation that happened this week on Thursday, whereby I was informed as acting minister, because my boss is away, that there is a patient that was found lying along the street of Salone. She was found to be pregnant and she was bleeding, vomiting, and was semi-conscious. And so the police and the passerbys called upon the National Ambulance Service in NEMS, who came swiftly to the place. And then while they were standing there trying to interview the patient, there was another doctor trained in Sierra Leone for his abroad doing postgraduate studies. He's here on holidays. He was just passing by, going to the beach to have a quiet evening. He saw the crowd, he went to inquire, and he immediately got involved in the patient's healthcare delivery system. However, things did not run according to expectations. The nurse tried to call according to the NEMS protocol, the ambulance service protocol, the surrounding hospitals of Kinyama Road. There was no place. We told her the hospital was full, and then she called again the BCM hospital, Christian Maternity Hospital. It was also said to be full. And then the philanthropic doctor, in line with his discharge of duty, said that is not acceptable. He is going to follow this patient to the nearest health facility, government health facility, which of the Kinyama Road Hospital. They came to the Kinyama Road Hospital. There was a nurse on duty at the triage, who for one reason or the other said there was no way they could accept the patient without escalating according to protocol to the other healthcare delivery system colleagues in house. So she turned away the patient, and the doctor tried to convince her it was not possible. So he again agreed or decided to follow the patient to the PCM hospital, where again they met with the same answer that the hospital facility was full and that the patient could not access the services. The nurse, for one reason or the other, at that point in time, they referred them to the Cooper Hospital. But then the nurse, I don't know in coordination with whom or with whom, decided to take the patient back to the Leone police station. And that is why the police, the AIG on duty there, escalated the situation again. And finally, the doctor who was following this ambulance called the Cooper Hospital because he knew people there. And finally, they agreed to accept the patient. So they went on route to the Cooper Hospital. The patient finally passed away. The doctor was there ready with all the gadgets ready for resuscitation, but then the patient unfortunately passed away due to poor judgment on part of those I've listed. And for us, that's totally unacceptable. That is totally unacceptable. And immediately after it happened, I got the information. 8:30, we summoned the top management of the Ministry of Health, the Chief Medical Officer, the PS, the Permanent Secretary, and the Deputy Minister too. All of us were zooming on the situation. We summoned all of them at the new building to have a detailed explanation of what happened. And indeed, they explained, all parties explained, from the doctor to the nurse on board the ambulance, to the doctors, all the medical superintendents, the matrons of the hospital, everybody was at UBD on Friday morning at 8:30. And after that, after explaining the situation was clear that there were lapses, people didn't optimally discharge their duties as they were trained to do. And so we decided to dish out punitive measures. Most of the healthcare professionals were suspended, some were given query letters, some of those who really were on contract, their contract were immediately terminated because those ones fall within the legal framework of what you can do with contract that can be terminated at any time. And then the nurses were suspended. When they come back, they will go through more training, refresher courses, and the matrons and medical superintendents have been really impressed upon to have their staff undergo this training in the fire system. There are fixed protocols in the country, in the ambulances, how do you escalate situation in the hospitals. And so with that, we have sent a strong message. I myself, together with Chief Pharmacy, made on the spot check at the PCM hospital to look at the facilities, to look at how the professionals are discharging their duties on Friday afternoon. We found lapses in what they were doing. Most of them were queried, some were put on suspension, to send a strong message that in the healthcare delivery system, everybody is important. If the supply chain has problems, it impacts the work of the nurses, the doctors, and everybody, the team. So with this, we want to impress upon the public that we are committed to have a quality, sustainable healthcare delivery system in this country where everybody is expected. If you see any lapse in our system, bring it to our notice. We immediately act like we give. Meanwhile, full investigation is going on, and a detailed report, root cause analysis, a copy of this report will be laid on the desk of the Chief Minister and everybody involved, so at least we all move forward with this.
The investigation is expected to shed light on the specific reason behind the woman's denial of medical treatment and the subsequent neglected by the medical professionals. For Star TV News in Freetown, reporting.